Hi, hello, this is Moon Griffon, the Moon Griffon Podcast. As you know, I do a radio program, 15 hours a week. You can check me out at moongriffon.com, moongriffon.com. Make sure you check us out on our radio program. You can hear it all over the place at moongriffon.com. Listen live. We're a syndicated program in the state of Louisiana. I also do this podcast, and looking forward to my guest today. I've got Mr. Charlie Katebi on there. Am I saying that right?
You got it.
All right.
You got it.
I'm going to call you Charlie because that makes it easy for me.
There we go.
But you are it's no doubt, but you're the senior health policy at American for Prosperity, which, by the way, is a great, great group. And you like to deal with Medicare. Let me ask you a couple of off-the-chart questions before we get into what we want to talk about today. Medicare, is this going to be broke? Is this going broke? If we don't change what we're doing now, is Medicare going to be a problem? Because that's really about our senior citizens, and nobody wants our senior citizens to be in trouble because we spend all the money or we're not doing something properly.
Yeah, Medicare. Yeah, the short answer is Medicare is in a huge amount of trouble right now. One of the piggy banks, essentially, that Medicare relies on, it's expected to go broke in 2031. There's simply not enough money coming into the system to pay for all of our responsibilities. And we are expecting about a 15% pay cut. Doctors, hospitals.
Wow.
Yeah, it's going to be huge. And that's going to mean a lot of doctors and hospitals won't be able to deliver the care that our seniors need.
But hadn't we had already cut back with Medicare with the number of doctors they even want to deal with it anymore already?
We're starting to see that a little bit, drip by drip. We're hearing doctors here and there announcing that, like, it just doesn't make financial sense for them to keep caring for patients on the Medicare program. But what we're talking about that's coming up very soon is a across the board 15% pay cut.
Wow.
And that is way bigger than anything that the Medicare program has experienced. And that's nothing that current enrollees have experienced in terms of a discontinuation in your care. So that's a big reason why Americans for Prosperity is really trying to work on these reforms, because we care about our seniors and we want to make sure that we have a healthcare system and a safety net and a Medicare program that could actually deliver the care that they need.
Let me ask you a question. What's causing the problem? I know when you fix a problem, you got to know what's causing the problem. And by the way, government doesn't do a good job of either. They just say, well, we got a problem. We'll just do this. But they don't really go, well, what's the problem? How do you fix that? And that's why you never see them get rid of programs. They keep every program, even when they add programs. So what is the problem? It can't be just money.
I mean, we can definitely drill down into specifics, but the bottom line is that Medicare does a terrible job at controlling costs, and a lot more Medicare enrollees are enrolling into the program every day. There's about 10,000 seniors entering retirement every year, signing up for Medicare. And the program and the policymakers that designed it did not prepare for the amount of patients that are going to be relying on the program, and they didn't put enough safeguards in place to make sure that care is actually being delivered cost effectively. So we're making a lot of promises, and unfortunately the program is doing a very bad job of making sure that care is actually delivered in a way that we can deliver sustainably. So it's a big challenge.
Yeah, another big question I had when you start talking about the problems, I know when I look at Social Security, which has gone broke, basically is in the same direction. But when I look at Social Security, what they did was they started adding new names to the list and new ways to get Social Security. And it put a lot more people on the program than probably should have been. And then all of a sudden we got less workers. You get the drip. Is Medicare very similar that we started adding people to Medicare that used to not originally be able to get Medicare? Is that come in play at all, like Social Security?
It's the people that are eligible for it, it's roughly stayed the same.
Okay.
65, you turn 65, you're eligible for Medicare. What is different than Medicare, than Social Security, and one thing that makes this problem so much bigger is that the costs of that Medicare has to deal with, they're so much harder to predict. The costs from one year to the next, there are new treatments coming online, new ways of delivering care. And so the challenge is just way bigger than just expecting a simple Social Security payment to come out.
Okay.
It's way bigger. Yeah.
And the sad thing about it is, and of course, I got a mom that's 87. My siblings, I'm 61. I got a brother 65, another one 64. You get it. We got 5 of us, and we're all headed into that direction. And what concerns me is, will it be there for the people who need it? And that's older people. And guess what? A lot of times you stay healthy, but later part in the life is when you start running into a few problems. We all know that. That's just the way it is. And that's why this has to be secured before we do anything else. And by the way, can we secure it, or are we just going to see cuts, which is not going to help the elderly citizens?
This is a big reason why we're working on a lot of these reforms related to site-neutral payments, really fixing the payments in the Medicare program, because we want people like members of your family to have that coverage when they need it. We're all going to be hitting 65 at some point in our lives, and our conditions are going to be a lot worse when you're in your 20s and 30s. Everyone needs to recognize that, which means that everyone has a stake in making sure that the program is there for when we all need it. So this is why we're really working on these reforms, to really bring down the cost of Medicare, make it more sustainable, and make sure that it's there when we all enter retirement. And that's one,
let's jump into it. You mentioned site neutral payments in Medicare. What is this? Right. How does this work? Can you give us detail for people that listen and going, okay, how's that going to work?
Absolutely. So right now, Medicare pays hospitals, and they pay the outpatient clinics that hospitals own 2 times, 3 times, 4 times more than independent doctor facilities. There is no clinical basis why this policy exists. However, this policy is dramatically raising the cost of the Medicare program. It's raising the cost of taxpayers by about $150 billion.
Wow.
And it's raising the cost to seniors. The premiums that seniors pay every month into the program to have that program, that's raising their cost by another $100 billion. So this is a major policy that's raising costs and essentially fast tracking this program into insolvency. So we want to really put this program back on the right track, which means equalizing payments between independent doctors' offices and the doctors' offices that hospitals own.
Is there any, this is really probably a silly question, but I'm going to ask you anyway. Is there any way to privatize any of the Medicare? Is there any way to, because when you get 65, you have to go on it. Is that a bad thing? Like, give example. So let's say I was just pretty wealthy. By the way, Charlie Katebi, my special guest with the senior health policy at the American Prosperity. I'm not that kind of wealthy. I wish I was, but I'm not. I go to work every day like everybody else. But let's say I was pretty wealthy. Would it be a way that, and I'm not trying to kick wealthy people. That's not what I'm doing. I'm just asking, would it be a way to go, you know what, I got mine, don't worry about me. Or somebody has health care from a company for the rest of their life. Or like state employees in the state of Louisiana, there's health care that I think they can stay on pretty much the rest of their life. Is there any way to make some adjustments like that? Or is that really not the right thing to do?
No, that's definitely something on the menu of options that lawmakers should be looking at. There's a lot of folks who would probably do better than going on to traditional Medicare. We also have Medicare Advantage, which offers a range of competing insurance plans. And I would say this, we should lean into those really good ideas that are in Medicare Advantage and let people opt out, find the best plan that works for them, maybe provide some sort of voucher program, and have Medicare contribute to that private insurance plan if that person wants it. That would definitely also go very far in stretching the longevity of the program and making sure that we're actually delivering care that people need. Everything should be on the table, but it should always be geared towards, one, how do we make sure we give people the care that they need, and how do we make sure we do that in a financially sustainable manner? Because all of this costs money, and we need to be very aware of delivering this care in a very effective manner.
to give an example. I mean, what if I was fairly wealthy and I got to be 85 years old, and maybe I spent a lot of the money or whatever, and then I got real sick, and then Medicare can come back in and help a person that's wealthy, that's been doing everything right the last 20 years, hadn't used Medicare at all. I'm just saying, it seems like there's some situational stuff that could help people maybe not get on Medicare. You can get on when you're 65 if you have to. But if you don't have to, maybe you don't have to get on until you're 85. I think you got enough. And it seems like to me some common sense things like that ought to be promoted. And then it may not affect but 10,000 people or 15,000 people, but it's still saving money to the Medicare program.
No, I agree completely. Another option that's definitely on the table that people have been talking about is means testing a program. So if you're a very fortunate, wealthy individual who just through their life has been able to accumulate, a lot of wealth, and you in fact don't need Medicare, we should let that person get care somewhere else and let the program be used for those who truly need it and have to rely on it. That would also go a really long way towards making sure that this program is strengthened over the long term.
But just think, though, I'm talking to Charlie Katebi. I'm 61 until I'll be 62, actually, in about a week. But when I got to be 65, I still have a younger wife and I have a special need kid. I'm probably going to have to carry insurance. And if I got to still carry insurance, I just soon stay on the insurance that I have right now. I'm not saying it's affordable because it's not. $2,700 a month is not affordable.
Oh, my goodness. Goodness.
Listen, Obamacare, when it came along, small business people like me, I'm not rich and I'm not poor. I'm that in-between guy. And what happens is they came along and I was moseying along about $400-600 a month. And then Obamacare came along and I remember him saying, I'm going to save you $2,500 a month in premiums. And now I'm paying $2,700 a month in premiums per month. And I don't say that to cry about it because I'm not. The Lord's blessed me. But I say it in the fact that that's a lot of dang money. And so for a guy like me, you say Medicare comes along, I'm going to get a break. But really I'm not, because I have a wife and 2 younger kids that are still on insurance. So I hope I can pay insurance till I'm 67, because I'm going to have to make sure my wife and kids are taken care of.
Yeah. I mean, Obamacare for sure imposed a lot of costs on a lot of people. And for folks like you, made it a lot harder for you to save for your retirement or even save for those long-term medical expenses that people are going to have once they get into their 60s.
Well, no, what they did with me with Obamacare, I know where we headed. I saw it through COVID. It's this single payer, single think phase where the government tells you what to do. They're going to eventually, I think, get to a single payer system, which is devastating. And I'll tell you who's going to devastate the most. Senior citizens that were Medicare recipients. When they go to ration care and everybody's under the same system, the senior citizen person is the one in trouble the most, in my humble opinion.
Of course. They have the most comorbidities. They have the most chronic conditions. Their care is the most expensive. So when those central planners start to figure out, all right, where do we got to cut? That's where the most expensive care is. And unfortunately, those are the most vulnerable as well.
But, when they started talking, and Charlie, I know you know this because this is something you follow a lot more than I do, and I follow it. When they started talking about Medicaid for all, you remember, I don't know if it was Elizabeth Warren or AOC, and I thought, holy cow, have you been involved in Medicaid? Have you seen the problems with Medicaid? And I thought, if that's where we are going one day, I thought about senior citizens, which I'm going to be one soon. Some people say I'm there already. But what I'm saying is, at that point, then they start doing ration care. The ones that are going to have to go are going to be the senior citizens. They're going to say, well, don't worry about them. Take care of these young people. And that's why we don't ever want to get into a system like this. I'm just throwing that at you because I'm thinking everything's really involved in what you're talking about, the whole system.
No, we see that within Medicare. We see that within Medicaid right now, even when you look at Medicaid expansion. When you bring new people into a program that it's not designed for, and you don't actually change anything else about the program, the existing recipients get cut, and they get hurt the most. They have longer wait times. They have a lot worse access at getting care. We've seen that within the Medicaid program. Elderly folks who are on the program on the long-term care side of Medicaid, they've had much harder time accessing long-term care, nursing home care after their state's expanded Medicaid. We don't want to see that happening within the Medicare program as well. We want to learn the lessons from Obamacare and make sure that we have a program that is there for those who need it, not for people who don't need it.
Yeah, that's the other problem that we have is the mentality of changing the way we do things. Because when I look at this, and you see the same things I do, you look at the federal government. I mean, we're $34 trillion in the hole. Biden's next budget says we $51 trillion in the hole in the next 10 years. Mm-hmm. I think it's closer to like 4 or 5 years. There's no money, Charlie.
Yeah.
I mean, we can say what we want to. Where is all this money going to come from? Do I need to pay 80% of what I make? Pretty soon you're taking the incentives out of everything.
Yeah, absolutely. I mean, this is why we are really so focused on these reforms, because we know that the costs of the federal government are going up. People are talking about raising taxes. We don't want to raise taxes, but we need to find a way to fund these programs sustainably, and we can't borrow a way out of it. So we need real, true patient-centered reform, puts patients back in control of our healthcare system, and really make sure that, we can actually deliver care without just dealing with these costs that just go up and up and up.
Charlie Katebi, again, Senior Health Policy at the American for Prosperity. Charlie, if you let's just say you could maybe wave a magic wand. I know there's no such thing, but let's say you could, and you could get the reforms that you're talking about with the site-neutral payment. How quick can this be turned around? Do you think it can be turned around? How quick, if you instituted everything that y'all want to institute, and maybe some other people, how quick is something like this turn around where we can look up and say, hey, this is solvent? Because everything we hear, 2031, that's 8 years. You know how quick that goes by in your life.
Yeah. Man, that is a really great question. I'm hoping we can. Site neutral payments is going to be a big part of it, but it's not going to be the only thing. Means testing is going to have to be considered. Finding a way to allow people to contribute to their health savings account once they enter Medicare is going to be another big component of this. But it's going to really take a series of reforms to right this ship. Healthcare has been broken by tons of individual decisions by policymakers over many, many years, and there will not be one single bullet. It's going to take a real concerted effort to really move things in the right direction. And that's what AFP is here for. We're operating in 35 different states. We're at the federal level. And we're willing to do that really hard work to really just acknowledge that healthcare is super complicated. But we are willing to work on these really complicated issues to make sure that our healthcare system actually serves patients.
I asked the question. You said it was a good question, but every time, you're going to laugh at me, but I'm good with that. Every time, especially politicians come back and tell me they got the answer to something that's never even close. And if they got to answer a problem, okay, they got to answer a question to a problem, and they're gonna redo some stuff but keep everything else in place, they never fix it. And I know you guys are not government and you're trying to fix it with some practical solutions, but the question still remains: how long, how quick? Because when I see government move, it seems we never get it right. It seems we don't even try. It's like saying we're trying to protect the border. It's not true.
Yeah.
I mean, you know what I'm saying? It's like, that's what bothers me. Guys like y'all, American for Prosperity, have answers. And I know there's people in Congress that are trying to do some of it. But on the flip side of this thing, we need some real solutions for some problems that we have. And so that's why I always ask. That's why I asked that question. I just want to see something get fixed. Look, I live in Louisiana. We don't even try to fix nothing here. So we don't. And I'll tell you.
Well, I'll tell you what. that requires a whole much bigger conversation, more than we have time for today. But I would love to come back and chat through both the reforms at the state level that AFP is working on and some of the other reforms at the federal level that we're working on.
We'll do that. And we also have on my radio program what's heard all over Louisiana. So I want to give you that opportunity again. I do appreciate it, Charlie Katebi, Senior Health Policy, America for Prosperity. Let's do it again soon. God bless and thank you, sir.
God bless you as well. Have a great day.
Yes, sir. Thank you very much. And by the way, folks, don't forget to check us out. Tell everybody about us. Make sure you subscribe. We need subscribers. We need you to subscribe, and we appreciate it. You've been listening to the Moon Griffon Show, our podcast. God bless. See you next time.